So here's my solar system. This is the kind of what I'm doing and what I plan to be doing. So at the center is Eating for Health, which is a whole food, local, seasonal, fresh, natural, organic, strategic model. So that's just pretty much axiomatic. It's the best way to eat well. Then Bauman College does professional training, so I'm doing very well with professional trainings. We're overflowed with people coming to school now because people want to get into the health field, and they love food and they love nutrition, and that's going to continue to grow. Bauman Nutrition is consumer services, so these are the community classes. This is the nutrition essentials, this is the community clinic, and so forth. And those are fee-for-services, but they're moderate, they're not exorbitant. Then the next ring, which I'm looking for some help with, is to create a foundation with a mission, with full accountability to do public benefit and public good for kids, for seniors, for people who are at risk, and for people who are ill and need a place to go. So we can do that. We have the labor, we have the knowledge, we have the media. We just have to kind of organize this thing and fund it. And then my bigger picture is to bring in national wellness in 2012. What I've been doing is taking Eating for Health to the community, and that's my daughter. So I'm happy to say that my 24-year-old is working in the school full time, and she's the outreach coordinator. That's pretty good. Going to schools, going to senior centers, going, dealing with all kinds of, we have 4 campuses. So we're doing community service everywhere. And nobody's paying for, government's not paying for anything anymore. So the idea of a foundation is it supports good work. And we have the idea of a foundation and we need support for this foundation. And I have hundreds of graduates who I want to put to work. Because if people go to my school, it's to create a career, and then they graduate with good skills, but starting your own business as a single person is hard to do. Or if you do it, it's hard to make it work. So with foundation support, I can get these people in lots of different places, and I can train and supervise them, and we can really change the way people are living. So the first program that we've been doing this for 3 years, is Kids for Health. So it's cooking classes for children with physical activity and age-appropriate nutrition information. I'm not brainwashing the kids. What I found is in inner city kids or in underprivileged kids or in any kids, if they get their hands on the food and they have their little plastic knives, they like that. If they get into the blender and they put together some smoothies, they like that. Better yet, if we do gardens and they grow some of that food, they like that. So that's really what's missing, is you don't get that watching television. So kids programs is great. Every school wants it, but every school pays nothing for it. So it costs me $5,000 or $6,000 to put on a 6-week program for kids. You go, why? Because I need 1 adult for 3 kids. If they're literally working, and cooking, you can't go, well, okay, there you go, because they're going to sword fight. So I can't be going down that road. And it's wonderful, being around food and making food and working through cultural, what does your people do, what do your families eat, getting the parents involved, it's huge. Transitional nutrition is a program my daughter wrote for homeless people and for people coming out of shelters. And those folks are pretty bright. And they have to learn to eat $2 meals. So it's a good way to work with what's available locally and not just eat out of a can. The food banks have lots of fresh food where I am. They really do, because we have a good agricultural area. So it's a matter, most of that food, 40% of the food in this country gets thrown away. So we got people starving and a lot of fresh food because people don't eat vegetables. The bottom line is people don't eat vegetables. They don't know what to do with vegetables. They don't know how to make a soup or a stew, or how to steam it or save it or cook it or put it away. So I'm bringing back home economics. But working in the shelters, there's shelter populations everywhere, and there's tons of people out of work. So for my business, the economic downturn opens up lots of opportunity to teach people how to live better, healthier, closer to the land. Then the one I'm just thinking about and that I want to develop is what I call Age Well for seniors, because I have a sweet spot for seniors. They're the people who come to my talks. I give free talks all the time. I give probably 100 talks a year, and most of the people who come are seniors. And they just don't know what to do. And there's little too much medicine and not enough health in the equation. So I go, you got time, what you need is skills, support, social learning. So I want to do Age Well. And again, Age Well is not anti-aging, we're all aging, but let's age well. And let's take even some of the lessons I do with the kids and do them with the seniors. So you know what I'm saying? It's just, wow, here's how you make a meal, here's the ingredients, go at it, and here's some of the health benefits without overstating them. Then part of the foundation is to have a place where people who go who are ill, because we're all either have been ill or have family members who are ill, and you look around and other than the hospital, there's nowhere to go. Or if you go someplace, it costs an arm and a leg. So I would like to provide accessible health education and health care for people who can come for a week or a month and get this kind of experience. I've been leading retreats and groups. Rick, I met him on a retreat. And it was a week long, so after a couple days you get into a nice rhythm being with other people and minimal TV and minimal media and don't, just be here, be in the situation, enjoy yourself. So it's important to have a retreat center where we can train other health professionals. That's important because everybody's doing something a little different, and in the field of nutrition, I'm one of the leaders, if not the leader, in this approach to nutrition. I've been doing it 30 years professionally. Most people are 5 years. They just kind of got started. I didn't get sick. Most people who get into the health field have gotten sick. They've crashed and burned, and then they've kind of gotten really sort of born again about all this stuff. And in some cases, they're a little bit manic. You know people in the health field who are just, every new thing that comes on, they're just super all over that, and they don't even understand it well enough to make sense out of it, and sometimes they overdo things. So I'm very level and very knowledgeable and very gradual in working because it's more important, particularly if you're dealing with people with major issues. And then really the final is eating for health videos and media. The revolution will be televised. So here's the camera. And we will make we will make impact when we get a positive message out in the world. Food Channel is neat, but there's not much health on the Food Channel. People love the Food Channel. So I want to do eating for health shows and lessons and get this out there. And it's not about me, it's just about health and education and teaching people skills. And that also creates family. It really, I mean, food is it's probably the #1 thing that people enjoy together. I would much rather make a meal than go out to the best restaurant. And I would much rather cook a meal with you than cook a meal for you.